Hi.
Hello, hi. How are you?
Very good. How are you? Thank you so much for joining in.
I'm good. I'm sorry I'm running a bit late. I just kind of rushed back from work.
This is something like you go on a blind date and then you're wondering, are you going to be stood up? Like, is the person going to come in or not? And what are you going to say the first time you meet the person? So, yes. So, thank you for not standing me up and thank you for coming in. And a little late is acceptable. But so you're coming back from work. So, you're going physically for work? You're no longer working from
Yeah,
home?
I kind of never stopped this year. So we because it's a multi-centered, like a multi-specialty clinic that we have. So we were seeing COVID patients also during the COVID time, and currently there's too much load of the post-COVID crisis that we are going through.
I can completely understand that. I stepped out of my house after March. Like March is when I came back from London to Delhi, and October is when I've traveled from Delhi to London. Like in between, I have not even stepped out of my house. Like maybe like 10 times, maybe I would have stepped out. Like I'm so paranoid. So I can completely imagine the trauma and the anxiety and the stress that I went through. And when I reached here, did I realize, oh my God, I was carrying it like such a heavy weight, all through that. I'm sure. And I mean, I have a bunch of questions that I've been given I need to ask you, but I definitely want to talk to you about what kind of conversations have you had with people who did have COVID, and especially in different phases of this COVID. Right? So remind me to come back to that. But first of all, let me just give this brilliant introduction that of who you are to anybody who's going to be watching us now and later. So, Dr. Rashi, you are a mental health advocate, consultant psychiatrist with MBBS and MD in psychiatry from Adarsh Nagar, Meerut. You have a keen interest in schizophrenia, epilepsy, and feminism in the world of medicine. You're working on bursting mental health myths and gaining new insight into mental illnesses. You're interested in how mental illnesses are related to hormonal fluctuations, especially in women. And you have been a speaker on various online platforms to talk about mental health issues that have increased, especially in the pandemic. So, why don't we start right from there? Please talk to us about what is it that you have observed? What kind of conversations have you had? Um, just share, please.
I think it would never be enough. More we talk about COVID, the more we feel that there's still a very big lacuna that we are somewhere not addressing. So now specifically when we say, so yes, there's two waves specifically that we mentioned, but we know it has been 1.5 years at least that we have been somewhere suffering from COVID. Specifically, I would say that working in the front line, second wave specifically was very, very stressful because unfortunately we saw that the number of cases that were spiking were just unbelievable. And every day when you are working, so my family also got COVID, so I know I've experienced it both hand, working as a frontline and then also getting it myself, that how traumatizing it can be really. And now following up with those patients who had COVID and now this post-COVID crisis, so post-COVID anxiety, depression, numbness, tingling, memory loss, like n number, I can go on and on. But it really amazes me every day how one illness could carry so much of this post-COVID era anomalies. Like people who have had any kind of mental health issue in the past, it kind of exacerbated. Even people who were on medication well maintained, they had to be restarted or increased. And some people who never had any complaints or never had any even family history of mental illness in their family, and not even COVID in their own family, just by the surroundings, looking at the television, seeing what's happening around them, full-blown anxiety and depression, clinical depression episodes. So every day is a new learning for you because we know there's very, very little literature regarding post-COVID mental health issues as now. So NIMHANS, the best institute of psychiatry in Bangalore, has issued a complete book on this post-COVID era and how we can better manage any kind of mental health issues that come our way. So yes, even when I would say doctors in all the branches are kind of trying to update themselves to keep up with this COVID. Initially in the COVID management and now with post-COVID, because we have seen that so many respiratory issues are still popping up here and there. So many mental health issues are popping up as it is everywhere. And then COVID not specifically affected your lungs only. It just, second variant was very variable into what organ it was targeting. So we are seeing everywhere from eye injuries to gut issues to mental health issues, that it could be anything. So probably anything out of the blue happening right now. My first question would be, did you have fever anywhere from March to June? So this is kind of a default question right now, because we know a lot of people got treated at home only. Everybody need not have that severe blown episode. So even if they say, yeah, I had a fever for 2 days and 6 days, and yes, everybody in my family had it. Like, it's by default, it was COVID at that time.
Oh my goodness. So there's my God, there's just so much to be done about this. Wow. And especially so there is the treatment for the physiology of it, right? And then there is the treatment for the psychology of it, right? So, I mean, apart from, let me ask a very layman's question to you. Like, you put it into different kinds of diagnosis and understandings and interpretations of saying, okay, this is clinical depression, this is what. But people come to you and talk to you about their fears or their stress, or what kind of conversations is it that people are having with you? And are you then giving them like medication for it? Or so it's just because I don't think enough is spoken about it. And I don't think I think the default response for anybody expressing any kind of stress or anxiety is, don't worry, sab theek ho jayega, deep breathing kar lo. Just breathe deeply and just calm, do your pranayam, sab theek ho jayega, don't worry about it. Right? That's a default conventional wisdom that floats around, anything to do with.
Yes, this is, I think somewhere we say this is gaslighting your feelings or emotions, but then again, this does not come from a bad place. Again, you said it very rightly. This comes from a good place, but this is somewhere defaultly inherited in us, that stop thinking about it, it will just go away.
Yeah.
But I wish it was that easy.
Yeah.
So yes, we have two kind of complaints specifically. I would like to mention that first of all is, or like, we somewhere categorize illness into mild, moderate, and severe. So severe is something we sometimes lead to hospitalization. Sometimes it lead to IV medication and very stronger medication, so that the person is in control at that time. So generally, when we see over the internet, on social media, everywhere, we talk about very mild level of psychiatric issues also. Maybe just and the words that we hear are just anxiety and depression. So psychiatry is much, much more than that. So it's de-addiction, it is psychosexual issues, and it is psychosis, which is such a big part that, but because it's not very common around us, so we think that it does not happen to the best of us. So yes, with the severe ones, we go for hospitalization and medication. With moderate, we start with medication and therapy both. But if it is a mild issue, again, we have various ways of categorization. If it is mild, we somewhere tend to look into the matter as to what it is really causing. This is with all the three types of categories. But my first always somewhere advice, or a kind of a persuasion on my part, would be that go for therapy. So if it is online, so mostly when we see patients online, they are more well-versed and more tech-friendly. So they're generally very open to therapy, and they might already be seeking therapy. And I advise, see, I've worked with these therapists and they're good, because I feel one therapist is not good for all. So try 2-3 people, and they have discovery calls. If you feel they're good for you, then go ahead with them. If it is an offline mode, so I generally don't take up counseling in offline due to just sheer time constraints. I have 2 psychologists, like one resident at my place and one separately on call. So we try to bring in best of both worlds and start therapy and medication both. Because I always feel, why to be on one modality for a longer duration of time when you could be on both for a shorter duration? And then again, just to somewhere equate it with physical health, if unfortunately a person has diabetes and they're eating sugar every day and you're not resolving the basic issue, the diabetes would not go away. So similarly, we say that medication are going to help you cope with a lot of things, but until unless you resolve what's really going on, it's very difficult that once you stop medication, that's why people say, hey, things are coming back, because you never actually addressed what was causing them in the first place.
So, Dr. Rashi, and I'm going to just jump in 1 minute very quickly because there's a lot of confusion between psychiatrist and psychologist and therapy and medication. Generally, जो बोलते हैं ना, अरे मुझे नहीं जाना because दवाइयाँ नहीं खानी मुझे, I don't want to become addicted, right? या थेरेपी के लिए बात करो तो बातें करने से क्या हो जाएगा? Like बातें कर लो तो घर में बैठ के हम बातें कर लेते हैं, right? So just burst this myth a little bit.
Also, me, like psychiatrists like me, so people who have done their medical degree, so it's their MBBS graduation, and there are various ways of becoming a psychiatrist. So diploma in psychiatry, MD psychiatry, DNB psychiatry. So, but you need to do something post grad to become a psychiatrist, a specialist. If you want to be a psychologist, so there are various ways of doing undergrad, postgrad. So their MPhil, then a psychologist will be able to tell you that RCI recognized certification or the college should be certified. So these ways, so a psychologist mostly deals with and only deals with therapy. A psychiatrist deals with medication and therapy both, but very rarely I've seen psychiatrists do therapy full time, just because of the sheer constraint that they have very less time on their hands, and we know therapy takes a lot of time, energy, and commitment for a long period. Now when people have this kind of notion, every day I'm busting this myth like 100 times a day that medications are addictive. So whenever I talk about psychiatry, I say it's a beautiful branch, but the one problem is that like the burden resides on the psychiatrist. Please take this medication, they are very nice. No, they will not cause you addiction. So sometimes you have to oversell that, yes, because person, even if they are very educated and very open to treatment, still they have this kind of speculation that please don't give me medications. And I have seen this in the even the worst of cases, when a person is not even able, has not been able to sleep for past few weeks, is causing chaos all around. Like when we say they have reached a point of psychosis, obviously therapy can't help them at that level. So you need to warn, let's see what is happening right now. No, you need to. So sometimes you have to be that commanding person also for the betterment of your patient. So you have to somewhere be like, no, I am the authority right now, and we have to do that just because we need to save a life. It also comes down to that level a lot of times. Coming to therapy and saying that talking does not help. So therapy is not talking. Like talking to your friend can be therapeutic. You are venting out. But therapy is not talking. Therapy is practice. Therapy is a technique. It's research. And it's very science-based. It's not like me and my friend being like just venting out, hey, this happened with me, hey, this happened with me, and we both are happy to go about our day after that. It's a lot of homework and research that goes behind it. Journaling, like depending on what your therapist decides to do with you, what kind of therapy you are into. Some therapists are drama therapists, so they try to enact what situation was actually causing the main issue in you. So it's not talking at all. People who've been to therapy will 100% agree that it is not that easy and smooth, and it's not like you imagine or in the movies that will come out flying and sparks are flying everywhere. Mostly after therapy session you feel very heavy because there's so much catharsis happening.
That's the, which is a movie, is the Alia Bhatt movies in the days in the cycling away to glory.
There's a lot of catharsis, so that's why a lot of time you might feel so heavy that you just want to be under a weighted blanket and be like, let me process what just happened with me.
There's a question that's come in over here, Dr. Rashi. And then we'll move to the next thing. It's saying, Anjali is asking, do you think psychiatry is colonial in nature? And if it is, how can we decolonize it?
I didn't exactly get the question. How is it?
Like, is it an inherited thing that we got because we were colonized, or it's coming from this whole Western medicine? Is the thought?
Not particularly, because things, psychiatric illness is not very, let me rephrase that. Psychiatric issues do not just arise in countries that had been colonized. It is a worldwide phenomena, and the studies that have been done, people again who have done the thesis and PhDs would know that how difficult it is to do a research. And then again, the research that base these medications are done in lakhs. So for us to have that kind of a variable genetic and racial pool to give us these results, it is very difficult to call it
Colonial.
somewhere that, yeah, I will need to think about this more. So this has
Yeah,
been
I
brought to
think
my attention.
because I think we really need to think about it, because what kind of research was done, and what were the frameworks, and what was the racial and genetic pools that were like we're discovering, like how heart disease is different, for manifestation of it is different for women than it is for men, but the entire research framework was based on a pool of things with men as the subjects. So I mean, I think this is an important question, and I'd
Yes,
be
but
much.
I think with everything, like take up everything, obviously a lot of things are European and American based. So that somewhere bias will be there. Like we see this idealistic beauty standard, that is a very European standard. And obviously that does not apply to us. We genetically, everyone has this fat around the belly, and we see people from the West and they do have these flat stomachs, and somewhere we lead our lives along the way just to
uh,
get that flat tummy, which we are genetically not
yes.
programmed to be.
So there's another question that's come up over here, is asking it, how will I know if I need to approach a psychotherapist or a psychiatrist?
Go anywhere. It's a good start. Generally, we say that if it is a minor issue and if it is something that is maybe not to an extent hampering your social, personal, professional life, and if it is more of a familial issue, more of a relationship issue, or anxiety stemming out of either past traumas, relationships, etc., therapy would be more suitable. And or if it is relatively little bit more serious or heavier, go to a psychiatrist. But then it is good to start with anyone on day one. Many times I get patients and I clearly advise them that, hey, I would not be able to give you medications for this because I feel this would not help you a lot. So
Yeah.
I'm like, clearly right, on medication is not needed, please go to a therapist. So it's a good deal to start anywhere. The main thing is just starting out.
Yeah, and that's, I think, the most difficult hurdle, because there's so much stigma attached to it. I mean, pagal thodi hu main, So it's there's a lot of stigma attached to reaching out for help for your mental health, and I think that's something that we really need to destigmatize and bring it on the same level of attention as you would give to our physiology. And that's very true. So I want to also ask you, your online presence is characterized by creating positive and safe and inclusive spaces for people, that where they feel comfortable in. Um, that's what we have been working on also in a different way. We're talking about, continuously talking about, what is a safe space, and where do I feel safe, and so what according to you is a safe space?
My safe space would be anything where I don't feel uncomfortable. So somewhere we have been, I would say, customized or maybe acclimatized to not feel positive. For us, comfort is just the absence of negative. And
Mm,
this is something that we are working on changing, that you don't need to somewhere earn rest, you deserve rest. So a lot of times we have been programmed this way that no, work very hard and then party harder. Why do you need to just earn that rest for yourself? So similarly, a safe space could be anything, and it could be very, very subjective for you, where you feel included. So specifically, I would say the internet has its own pros and cons, but the internet has become a beautiful place where people feel very inclusive,
mm.
because they might not feel that inclusive with people around them physically, but they feel that okay, they might feel isolated, that nobody thinks like me. But when you go over the internet, you'll feel, oh, there are other people who have the same mindset. So that might be a safe space for me.
Hmm. So how do you create that safe space for the people who come to you? Because many people who would be coming to you would actually be uncomfortable. They are already uncomfortable within themselves, and they're kind of reaching out to, and also you said something really interesting, like comfort is not the absence of negative, right? So how do you move from that absence of negative to an actual positive place? What does that journey look like for you?
See, people like you and me, we are trying very hard to advocate this, that uh, maybe I would not want to say it otherwise, but see, there is a generational change also happening. Maybe we don't see it on a day-to-day basis, but now when you will talk to your mother, When I talk to my grandmother, I realize how much of a cultural shift is with everything that's around us. We're not just talking about smashing the patriarchy. We're just talking about sexual education, or let's just talk about menstrual education, or maybe just mental health. Like, pick up anything and you will realize that even if in your own family people have such different views when you have been brought up with the same environment. If people in your family can have such different views on things, imagine how the world is functioning around you. So that's why we say that unless we make it a normality everywhere, that hey, it's fine to talk about mental health. It's as normal as talking about your physical health. So it's absolutely fine. And that will only start when we started from school at a very smaller level. There is a change happening. You talk to grade 6 and 7 class students and they will know words like anxiety and depression. And I for sure did not know them.
That's true.
So there is a change happening. At least they're coming in conversation. So we feel that yes, a lot of change is happening. But then again, are we just learning the terminology or really understanding and grasping it and not just glamorizing it?
That's so true. And there's a question over here which is related to this, I think. Is chemical imbalance starts in which age, Rashiji?
Any age. So there are very different drugs for children which have been approved for as low as 6 years of age. So we are not, a lot of drugs are not approved like antidepressants to give to children below 6 years of age. But clinical studies have shown that at children as small as 6, 7 years, 8 years of age, and I personally also treated many of them, not just family issues, not school issues, not friendship issues. Clinical depression does occur as small children as 6, 7 years of age. Again, when we talk about these two illnesses, which is very commonly heard every day, the most common age for occurrence is 18 to 25 and females more than males due to hormonal, socio-cultural expectations. We
Talk
never
more
blame
about
it
that.
on
You talk more about that.
Okay, so I feel that we talk a lot about the menstrual cycle, that how much it affects the mood, then how we are somewhere busting the myth that PMS is not just a mood swing, how it is an actual disorder, and how PMDD, like premenstrual dysphoric disorder, exists. And we should not brush off it saying that, hey, it's that time of the month and that's why you're cranky. But we somehow do not give enough weightage to the fact that why this is occurring in the first place, that the socio-cultural expectation of a woman, how much it somewhere burdens her to translate into this. And for sure, there is no way of having like a study to prove that how much the socio-cultural expectation is actually causing n number of problems that they are actually causing.
Yeah, and if we don't even have research, then how does it impact policies, or how does it impact the conditions that we create in the world to address the needs, the special needs that are there, cater to the difference, cater to the requirement. That's so true. Thank you. So coming back to when you're saying that there has been a shift between the generations, right? Another very popular term which is being floated around right now is intergenerational trauma. I'm sure you must have. Why don't you talk a little more about that? Because for many people, it means many different things.
So when we talk about intergenerational trauma, we say that I will give you a little bit more biological reason also to that. A female, when she is a fetus, her ovaries, like her ovum develops inside the womb. So when she is born, there's a limited number of ova storage that she has. And out of that, a child gives birth. So the ova I am made up of was inside my mom. And that was formed when she was inside her mother.
Beautiful.
So somewhere the ova has passed on from a lot of generations and led to me. So if something so beautifully genetically lead to this creation, how is it possible I would not be carrying the trauma that she would have born at that time? We say that a lot of things are genetic, like 1/3 anywhere. Roughly we say everything is 1/3 genetic and 2/3 environmental, be it obesity, be it diabetes, be it mental health issue. I'm giving a very rough estimate. Obviously it will vary from illness to illness, but as low as 1/3 is there. So if biologically I'm formed 2 generations back, my trauma can also very easily be carried out. So this is just about the physical, the genetic development. Imagine how much of a psychological passage is possible through that. But again, we say that if we are inheriting a lot of generational or intergenerational trauma, then similarly we can also process it and pass down the healing to my future generations. It has very clearly been shown in studies that immigrants, migrants, refugees, they carry it more, and they have more kind of mental health issues than others. I will not specifically name any race here, but studies are very specifically mentioned that 3:1 ratio, 2:1, just depending on what your forefathers were doing at that time.
And if I bring it back into your being a feminist and you're doing so much of gender studies and everything and relating it there, how would you equate this in the context of when we say 1 in 3 women are going through domestic violence or 1 in 2 children are suffering from child sexual abuse? How would you tie up this?
I don't even think these stats do the justice. I work in a tier 2 and I also work with tier 3 cities. So I understand that when I look at these stats, I somewhere see that they're laughing in my face. That you actually don't know the real picture. I have treated the physical ailments also of people having domestic abuse, and it is not that easy to move on from. Like even for yourself, when you are a young doctor, when you're 20 to 23 yourself, you're full of life and you come across these things, it leads you into thinking more that what could I have done better so that the other person is not in that condition. But then again, ultimately whenever you try to fight a battle for the person, the first question that comes from their end is, where would I go or what would I do? And to that, I might not have a very accurate answer to. So that's why when we see a lot of things protest on social media and the newspaper and the television, we don't somewhere cater to the on-ground reality. It's very easy to talk about rights, but we know that how difficult it is to live with the difficult decisions you make in life.
Yes. So true and so sensitively articulated, Dr. Rashi. Thank you so much for this. I don't know if you know too much about what we are doing, but that's exactly the space that we're trying to address through the Rakshin Project that we're running, in which we are saying the answers have to come from within the families, and let's bring in the light within the family and educate people within the family so that we can create an environment where there can be an intervention from within the family to stop the sexual violence, to stop the gender-based violence, to recognize the acts of microaggression, to actually identify casual sexism in your own behavior. So this is the kind of work that we are doing, and thank you so much for bringing it together to say that what we are really trying to do. And somewhere I have also studied and read that the trauma that comes from an experience of sexual violation is equivalent to that of being in a situation of high conflict zone, like maybe a war or bomb blast or something like that. So would you like to just talk a little more about that?
Yeah, so there's this phenomenon of PTSD, that is post-traumatic stress disorder. This was initially found and researched more with war veterans. But then again, when they studied this more in the general population, they found that they had similar symptoms to the war veterans. Hence, it was brought down from the trauma was equal to war. So they brought down the trauma, that anything that could be traumatic to you, and not even to you, for people in your vicinity, could lead you to develop PTSD. So it is not even necessary for it to happen to myself. Even if people I love and care about, if it is happening to them, even then I could get PTSD, which is also happening in COVID.
That's what you spoke about when we started our discussion, right? So not everybody who, like there is somebody over here who's also asked a question, and that generally is the perception and maybe experience, unfortunately, for many. This person is saying, ma'am, will it be wise to consult a psychiatrist considering the fact that most of them are minting money and would make a mountain of a molehill? I mean, exaggerate it instead of trying to help us. Now, all of these are fears that we have inside us because you don't know enough. So just speak about, so what my question to you really is not just answering this particular question, but my question to you is to just tie up what we've been talking about, how important it is to recognize the impact of violence within a domestic setup. It could be sexual violence or any other form of violence that's happening there. It could just be also not only necessarily for you to have gone through it, but for others. And then this mindset which says, but what can I do about it?
So we say that you do not just go to anybody, even for your physical health. I'm sorry if anybody has a bad experience, but then again, believe me, everybody is so worked up. Actually, I personally saying, or for all the psychiatrists I know and I speak for them, do not have the time to cater any more work on our hands. That's such a worked up field. But still, if you feel skeptical about seeing a psychiatrist, then you can start with therapy, and your psychologist could suggest you a therapist who they are in. Mostly all the psychologists work have, or in the past or right now, would have worked under a therapist, would have worked under a psychiatrist, and they would be able to guide you through. If you feel they are charging less than a psychiatrist, because I don't know, in tier 3 cities, I'm charging somewhere from 150 to 200 rupees. So I'm really not aware about how the charges are very increased for you. And still in that case, please go to a medical college. The psychiatry department would be charging somewhere from 1 rupees to 50 rupees. So I don't really think that why it has been such a big issue. Psychiatric help, like any other help, is very rarely available at a medical college near you. We have good medical colleges throughout the country in all the good cities. 1 rupee to 50 rupees, very well affordable.
My goodness, these are not prices that I have heard of, and my head is exploding just hearing all of this. So I must have an offline conversation with you about this. Thank you so much for sharing it so candidly, Rashi. I have another question for the same person, and we must address this. It says, ma'am, I sometimes feel very bad that my parents are worrying because of my OCD. What should I do?
See, if you are a minor, unfortunately, by the Indian law, cannot be treated without a parental or a guardian's consent. If you are a major person, then please start considering therapy by yourself. And thanks to, I think, would say somewhere a silver lining in COVID, that we could take therapy from the comfort of our home and you don't have to move out. So a lot of my clients, even for patients I see for online treatment, they just come for therapy also, not for medication. But then it's up to your psychiatrist's discretion if they want to start any or both. But then again, start with therapy if you're skeptical about medications. Many patients come to me after 6 months of therapy and they feel that they did not do as much progress as they expected themselves to do. So many times starting both can be very good. Unfortunately, there's no way in which you could force your parents, but having an open conversation about mental health, showing them some videos, or maybe if they could talk to somebody who has had a good experience with a psychiatrist or a therapist might help.
Thanks, Rashi. I want to take you to back to the conversation that we were having earlier, and I just want to know from you. It's said, and I've read, and there's lots of conversation about how trauma resides in my body. Yeah. So do you want to talk a little bit about the role that body has to play where healing from trauma is concerned? So I want to move from the experience and what causes the experience of trauma to how there's healing. And you said that if trauma can travel through generations, so can healing. So just bring all of that together in this.
A mind and body working sync with each other. So it's a continuous conversation. Obviously, your brain is not working separately. It's how your body is working along with your brain. So anything that happens in your mind will affect your body. We say that it's like a cobweb, or emotions, all your hormones, all your neurotransmitters, they are kind of chemicals, and imagine it like a cobweb. So it's very difficult that you can take 1-2 strings out of a cobweb without destructing the whole structure or even some of it. So similarly, I'll give you very small examples. The thyroid issues, it present with any kind of mental health issue in 30 to 40% of cases, because thyroid hormone goes somewhere, it does something, leads to depression and anxiety. So hence, it is not that easy that pulling one string will not cause other issues. So thyroid is a physical issue, it's a hormonal issue, but it is also causing a lot of mental health issues. Similarly, when we say that trauma, if it's residing in your psyche, in your subconscious, it will somewhere show up. It might just be an impulse reaction. It might just be a chronic gut issue. So a lot of people have very chronic, like we say that IBS is a chronic gut disease. It also presents somewhere intermittently or chronically or cyclically, which might just be a body's way of excreting the trauma. So my very good psychologist friend has told me this concept, and even I was very amazed to learn that how much physically your body excretes out trauma. So it could also be just excessive sweating. It could also be just a lot of watery diarrhea.
Wow. I mean, I am amazed, and I think I really need some more in-depth conversations on this. And there's somebody here who's saying, Rashi ji, I hope you will be one of the members of the IMA Council. And I say yes to that, because
Thank you so much.
आपने इतनी clearly, इतनी साफ और सरल और सहज तरीके से you have spoken about such complex issues. और हम फंस जाते हैं बातों के जाल के अंदर. Maybe kind of get swamped somewhere, and we don't really get to the crux of it. And I have so many questions that I want to ask you here today. But I think one more thing.
I think we'll have one more video after that to accommodate that, because I think I'm also running a little late on the work I have pending in hand.
Yeah, so let me just very quickly do a kind of a parting round with you, which is like almost like a rapid fire. So just, yeah. So, okay, 3 words that you would describe yourself as.
Unfortunately, impulsive, feminist. One more word. What would I be? A very clean freak.
A very?
Clean freak.
Clean freak. Okay, I like that. Nice. Food you would die for.
Oh, I love aloo bhujia. This is very strange. I die for aloo bhujia. Like literally, I go to places, I travel far and wide, and I try to eat everywhere specialty. So I love Jaipur's. मतलब इतनी अच्छी कहीं नहीं मिलती.
Your favorite song?
I have so many songs, but I think there's so many. This reminds me, मैंने बहुत दिन से गाने नहीं सुने. Okay. Oh, I can't remember it. So this is what my husband sings for me. I'll just say that one only. I'm having a thought block.
Okay.
तुमने ज़मीं पे कदम रखा, आँख तुम्ही से चार हुई, हाँ रात कली जब ख्वाब में आई. Yeah, this is one he sings for me. So he sang this for our wedding, so I remember. Yeah, this was. I hope he does not see this video.
A movie that you cannot forget.
I don't think things stay with me for that long. No movie or shows. I tend to get a lot involved with them, and then I move on very quickly. I don't think anything has, fortunately or unfortunately, impacted me that much.
Great, nice. Equality for you means?
Everybody, like not just when we talk about equality, it does not just mean that I will have equal rights, like or specifically coming from suppressed person to the oppressor in any case or scenario. It would also mean, like, more than equality, we say that responsibility also, like equally. So if I want equal rights, then I am ready to take up equal responsibility financially, emotionally, in every way possible. So I'm not just demanding rights, I'll also, but then again, I say it is very subjective, comes from a lot of place of privilege for me to say these kind of, to even imagine these kind of things firsthand.
Accepted. Safe space for you is your safe space.
So my walk-in closet is my safe space. And there have been times the family has gone looking and they found me inside the closet. And it's not like a very small. It's a walk-in closet, so it has sufficient space to accommodate me inside.
Nice. Sexually, you are?
Mm. I like, how do I feel this? I don't want to say something inappropriate. I get turned on by most random things.
Nice. Your parting words would be?
It's not sufficient enough to talk about it until you are somewhere implementing in your day-to-day life. So it's very good to always be like, yeah, feminism rocks and everything, and be like, yeah, mental health, kudos, work on it. But then going behind and in office, be like, they're treating help. So until unless you start implementing it on a day-to-day basis, start helping your wife / mother / sister in the household chores, everywhere equality and just mental health issues, just talking about them would not suffice. Start implementing it one by one. Point out to people about colorism, sexism, in not to use these words casually in your home and workspace. Only then change is going to come.
Yes. So
Start having those uncomfortable conversations. I have raised a lot of eyebrows at a lot of events, and I'm proud somewhere to have done that in the past.
great. Excellent. I mean, this has been one of the best conversations that I've had, and I hope we can continue to have these conversations, Rashi. This is really good, and I'm sure all the people who have logged in over here share I lots of comments over there. So, yeah, but I'm yeah, so please, somebody saying, please accept my follow request to Nishita Gupta, Dr. G. So there are lots of comments, but I'm just very quickly going to do a formal closing because we want to take this conversation onto other formal platforms also. So thank you everybody for joining in here for this conversation with Dr. Rashi on Sakshi Speaks. We will continue to talk about safe spaces and mental health. We are still trying to understand the impact of this pandemic. Like another friend had shared before COVID, we had drowned ourselves in work. We had drowned ourselves in activity, and then suddenly, boom, life slowed down. And then all that we had parked earlier and said, oh, we'll deal with it later, we will deal with it some other time, it suddenly surfaced, and it's forcing us to relook at everything that we have actually kept suppressed inside us. And so, yes, we do need to keep talking about everything which is surfacing and find the right set of ears, like Dr. Rashi has emphasized again and again. Your discovery calls. Find someone who's compassionate, who's empathetic, and like she has emphasized, somebody who's trained. Everybody is not a psychologist, everybody is not a therapist, and everybody is not a psychiatrist. A conversation with a friend can be therapeutic, but it is not therapy. So if we have to make each home a safe space, really, really a safe space, we need to recognize that we have intergenerational trauma that needs to be healed. If you want to know more, please join us at www.therakshinproject.org. It just takes INR 1,000 rupees only to educate one young adult over 2 years to make homes a safe space. Please consider donating and sharing the fundraiser with your friends and family. The link to donate can be found in the bio and is always, always there. So educate one young adult in each home. Stay safe, stay healthy. Thank you so much, Dr. Rashi.
Thank you so much for having me. It was an absolute pleasure to discuss. Again, as I say, online you find your people.
Yes. Yes. Thank you. Bye-bye.
Have a very good evening. Bye-bye.
Bye-bye.